In our spotlight, Dr. Adam Clark, the director of cardiac electrophysiology at Vidant Medical Center. Good morning, sir. How are you? Did I pronounce that right?
Definitely. Good morning, and I'm great, and I'm happy to be here.
It's good to see you. We want to talk about AFib this morning. Stan was just telling me also it's Stroke Awareness Month at Vidant. Is that right? Is that national? That's the
right.
National Stroke Awareness. So we hear a lot about AFib. And that's kind of what you do, right? Do you consider AFib heart disease?
It is heart disease. AFib is an abnormal heart rhythm. So normally the heart is, I think we should back up to how does the heart really work? The heart's a pump. And it is two pumps in series, one pump that brings blood from the body to the lungs, and one that brings oxygenated blood from the lungs to the body, and they work in series. In a normal heart, there are loading docks called atria, and those pump blood to the pumping chambers, which are called ventricles, and those work in synchrony. And in AFib, the upper chambers, or the atria, which is what the A stands for, atria, the upper loading dock, is pumping rapidly and chaotically at over 400 times a minute. That causes the lower chamber to beat rapidly and for patients to feel fluttering, palpitations, heart racing, shortness of breath. And the biggest thing is that it increases your risk for stroke 4 to 5 times.
The heart is an amazing organ, is it not? I mean, you think about, I'm 67 years old. How many times does my heart beat? And, you wonder why did it wear out sooner? You know what I'm saying? But
it is an amazing organ. It is. The rest of the body functions to keep the heart functioning. That's just my view as a cardiologist.
Yeah, some of your colleagues over at Vidant might not agree with you on that.
That's true.
So who's most at risk for AFib? Does it have to do with age? Does it have to do with lifestyle? I mean, what causes AFib?
Age is the number one risk factor. There's a direct correlation. As we get older, the risk for AFib increases to the point where 25% of patients over 80 have atrial fibrillation. But it's not modifiable. So we try to focus on the modifiable risk factors for AFib, which is obesity and sleep apnea. So those things can be identified and treated. If you can lose 10 pounds, you can lower your risk for AFib. So it's incredibly important to focus on obesity and to lower your weight.
And sleep. It's interesting you say sleep apnea because I've got sleep apnea, and I've been sleeping with a BiPAP for 12, 15 years. And I know I have friends who have sleep apnea that I just cannot use that thing. And of course, now there's the surgical device. In full disclosure, my daughter works for Inspire Sleep, and they're now inserting the surgical device for people who have trouble with the mask. But a lot of people that sleep apnea go untreated, and that's really dangerous, isn't it?
It is very dangerous, and it's been clearly shown that treating sleep apnea also treats AFib.
Had that conversation with a friend this weekend. I hope he's listening. Because I was like, you can get used to the mask. You just have to try. Because it's unnatural when you first start it, but man, I can't sleep without it now.
It's true.
I can't even take a nap without mine.
And your energy levels probably better.
Much better. So back to AFib. Is there a particular region of the country where AFib is more prevalent? I know we keep hearing. Sometimes we hear the term that we live in the stroke belt. Is this area?
That is true. Although the entire East Coast is riddled with AFib and has the highest incidence of AFib in the country, but also in the world. So our risk is 20. Our incidence of AFib in North Carolina, and especially eastern North Carolina, is 10 to 20 patients per every 1,000 people. So it's incredibly
much higher than the average.
It is.
Yeah.
It's much higher. If you looked at a map of the United States and white was a low incidence of AFib and dark red was a high incidence of AFib, North Carolina is the darkest red, you know, blood red, because of the prevalence of AFib here.
So, again, if you just joined us, this is Dr. Adam Clark, the Director of Cardiac Electrophysiology. Did I get it right?
That was perfect.
Electrophysiology, Vidant Medical Center.
I'm an electrician of the heart.
Yeah. I think you're a little more than an electrician. But so how do you know if you've got AFib? If you've got it, do you know it? Do you feel it?
Actually, that's a really important question, because half of episodes of AFib are completely asymptomatic, but they still increase your risk of stroke 4 to 5 times. So identifying it and determining if you need to be on a blood thinner to protect you from stroke is probably the most important message that I can pass on today. So there's everyone over 65, and the primary care physicians in the region know this. Every time they come in, they palpate their carotid or their radial artery. They listen for an irregular heartbeat. And if they can identify AFib, then they take them down the path of determining whether they need stroke protection with a blood thinner.
But do you feel it in your chest? Can you feel AFib? I mean, who was it? One of our was it Bush #1? I think that had AFib.
I think you're right.
They took him in and they did the shock thing to his heart, and he talked about how he could feel it. And
you can. Many people do. Feels like butterflies in your chest.
Yeah, right.
Fluttering, irregular heartbeat.
But you don't always get that?
No, only half the patients can feel it.
No kidding. So what's the treatment? What do you do for people who have AFib?
The treatment ranges from medications to control the heart rate and blood thinners, as I talked about, to medications that return you to normal rhythm, to a cardioversion, which is an electric shock of the heart to return the heart to normal rhythm.
My father had that, by the way.
Yeah. It sounds dangerous, but it's quite safe and quite effective, at least in the short term.
Do you do like the paddles, like you see, when they say clear and all that? Is that the same kind of thing you do with the heart?
We have paddles as a backup, but they're now pads.
Okay.
Soft pads that go on the
Sends
chest.
a little shock into the heart, and
it reboots the heart,
and it knocks it back in rhythm. That's interesting.
And then over the past 10 years, ablation of the heart has become the standard and quite effective. And we probably do 1,000 ablations here a year.
And that's surgery. For people who don't know what ablation is, that's surgery where you go in and you actually burn off some of the what is it?
We use heat or cold to create scars in the heart, areas of electrical block to prevent the AFib from occurring. And we do that through the veins in the groin at the top of the leg. So it's non-invasive surgery.
So I love these Vidant segments because I learned so much, and we're getting so much information out that people need to know. So you've been great. But tell us how to prevent AFib. Can you prevent it? I mean, I'm at the age where I'm at risk for all sorts of stuff, including that. How to prevent it?
What are the main areas to focus on would be no moderate or heavy alcohol use. So no more than 4 ounces of wine, 8 ounces of beer, 1.5 ounces of whiskey a day.
So alcohol can really affect it.
Alcohol can. Smoking.
Yeah.
Treating your high blood pressure. High blood pressure can increase AFib, and again, weight loss and sleep apnea. Those are the things that we all need to do to prevent AFib, because we can't prevent, at least not yet, we can't prevent ourselves from getting older.
They haven't figured that one out yet.
They're close. They're closer than you
probably
realize.
are. They probably are. All right. So, what resources are available if people want to learn more? Should they? Is there something online? Contact your office here in Eastern North Carolina. What
Yeah,
they want to
call
know?
my office 758-3211. Or
can you give your cell phone out in case I need? No, I'm just kidding.
I'll give it to you after.
I'm just kidding.
But Probably the best resource, we have resources on videnhealth.com, also the American Heart Association. If you just Google atrial fibrillation, AFib, the American Heart Association comes up first, and it really has wonderful resource to teach you about how to identify it, how to treat it, and who to call. And I think that's probably the best resource.
And do you? We're at a point where medicine has gotten to the point where you have good outcomes with this if people get it, if you catch it, right?
Definitely.
Yeah. I mean, is it something that will come back if you've had it and you get it treated? Will it come back later?
We don't yet have a cure for AFib. That's true. We're not there yet.
I don't know who this is that just texted me, but said, Dr. Adam Clark is the best. He has been so great to my father. It's a great interview. Text me who you. Oh, let's golf soon. It's I lost my phone got wet, and I lost a bunch of contacts.
Oh, so it's just a number.
Yeah, so it's just a number. So text me who it is.
I do live on a golf course.
Oh, you do?
Although I don't golf. Sorry.
Oh, you're kidding. I
have clubs.
We got to. I was hoping you were going to say that golf was the answer to AFib.
Golf while you walking the course, 18 holes.
How about if you're walking from the golf cart to the ball?
That's a start.
That's better than nothing, right? All right. Hey, this has been great. It was Nick Crabtree. Thank you, Nikki. Yeah.
Please tell him. Yeah,
Nikki, your number got lost in the sound. I'm sorry, but I'll put you back in.
Please tell him and Eddie I said hi.
Yeah. All right, great. Listen, this has been good. Anything that I didn't ask you that is pertinent that you want to mention?
I think that screening for AFib, identifying it, and focusing on stroke prevention, that's number one.
Great.
It should be on the front of everyone's mind.
Dr. Adam Clark, Director of Cardiac Electrophysiology Lab. I always have to read that really slowly because it would mess it up. At Vidant Medical Center. Good to meet you. Great
pleasure to meet you too.
Yeah, good to see you. Thank you, sir. Appreciate you coming in.